Hello, everyone. I'm Assemblymember Rebecca Bauer-Kahan, and today I'm happy to host a conversation about the brand new drive-up testing sites in Alameda and Contra, Costa County. I'm joined by Dr. Svieli, Deputy Health Officer from Contra Costa County Healthcare Services, and Rick Shumway, CEO of Stanford Valley Care. Thank you both for joining us today.
Thank you for having us.
Yep. Of course. The governor recently announced California's 6 indicators for modifying the stay-at-home order. I know we're all waiting for those modifications so we can get back to life, but one of them relates to increased broad community testing. So I know there are a lot of questions out there about when are we going to get to that testing. So we want to talk about that today. As many of you know, California has been behind as it relates to testing, but just next week, we're expected to increase testing to 25,000 people a day in the state. So that's exciting news, and our partners in doing that locally are here with us today to talk about it. The state is also working with local health departments to stand up an additional 80 testing sites in California. And I'm happy to say that last week, Contra Costa County launched 4 drive-up testing sites, and the Tri-Valley opened its first one this week. So this is all great developments in the ability to test our community. Dr. Svieli, where are the testing sites in Contra Costa, and when are they open? Can you tell people how to access them?
Sure. So I have good news. We're now up to 5. We opened a 5th site on Monday. They are at the West County Health Center, the Martinez Health Center, the Pittsburgh Health Center, the Antioch Health Center, and also in a county building on Bates Avenue in Concord. So those are all drive-up sites. You call an 800 number. It's actually 844-421-0804. Again, that's 844-421-0804. You are screened for symptoms by a healthcare provider. We're only testing symptomatic people at this point. And right now, and if appropriate, which most people who call are, you will be given a choice of which of those sites you want to go to and an appointment time, and you will drive up and stay in your car, and you'll roll down your window and someone will collect your specimen through a nasopharyngeal swab and send it off to the lab. Right now we're Monday through Friday, but after this weekend, so starting the weekend of May 9th, we're going to be going 7 days a week. Not at all of the sites, but at least we'll have at least one site available all 7 days of the week. And we are actually in negotiation with the state to open up 3 to 4 additional sites. So some of those 80 sites that you mentioned at the beginning are going to be in Contra Costa County. And we're hoping that at least one of those will be in San Ramon, and we'll be able to talk about that more tomorrow. This testing is available for people regardless of insurance or ability to pay. So we will send a bill to your insurance, but even if you're uninsured, you are welcome to come and get tested. And we will not be collecting any money from people at the point of testing.
And then they won't be billed later?
They won't be billed later. It's going straight to the insurance. The main symptoms are fever, cough, shortness of breath, fatigue, chills, sore throat, and then loss of sense of smell or taste are some of the other symptoms. We're following the CDC and CDPH closely as the symptom list expands or shrinks, and that's why we have a healthcare provider doing that phone screening. At this point, we don't have antibody testing yet for a variety of reasons. But the main reason is the antibody testing is only useful once there's enough COVID-19 in the community, and we don't think there's enough in the community for the test results of the antibody screen to give you meaningful information. So at this point, we're doing direct PCR, direct testing for the virus. So it's for people who are symptomatic. It's not going to tell you whether you had the virus 2 or 3 weeks ago. It's if you're wondering, I'm sick now, do I have COVID-19?
Great, and is that 9 to 5? What are your hours at those testing sites?
8 to 3:30, Monday through Friday, and in a couple of weekends, we'll go the same hours on the weekend also.
Great, well, thank you for that. It sounds really straightforward. Just call the number, and then if they qualify, go to one of these drive-up sites.
Yep, and we want to make it straightforward. We want more people to be tested. We recognize that more testing gives us a better sense of what's going on in our community and when it's safe to reopen for business.
Amazing. And how many people are you testing per day at these sites?
Right now, I think it's been about 150 people a day. We're hoping to, we would like to get up to about 100 people per site per day. And if we're up to 8 sites by about a week or two from now, we'd like to see it up to about 800 per day.
Amazing. I mean, that's a 5-fold increase. That would be phenomenal.
It is, but that's where we need to go.
Yeah.
Yep.
And you've been saying that the 5-fold is where we need to go. So it's exciting to know we're almost a week away from that. So happy that you're doing that. I'm glad to hear that our support at the state level is helping. So Rick, you guys opened the drive-through testing site at the fairgrounds this week. Am I right?
That's correct. That's our our newest site, and it's an interesting site. At Stanford Healthcare, we've actually established this will be our 3rd in Eastern Alameda County. However, this one's a little different than the other 2. The other 2 are located here on the hospital's campus, as well as another site that's located at Stone Ridge Drive, right behind our cancer center here in Pleasanton. And those function very, very similarly to what Dr. Civelli was talking to us about. And similarly accessed, we treat the same kinds of patients, symptomatic patients, with doctor's orders through those particular drive-throughs. The one that we worked out this week, started yesterday, was actually in partnership with the cities of Dublin, Pleasanton, and Livermore. And the primary focus of that site is to broaden the testing net, if you will, beyond symptomatic patients. So this is an effort to get a broader swath of our community. And so what we've done is, when you look at the criteria for needing to be tested, of course, if you're symptomatic and you're exhibiting those symptoms and have a request to be tested, you can come through. But we've also indicated that there are groups of people, like those that are over 65, those that have a pre-existing medical condition, those that have been pregnant or are pregnant, homeless individuals are able to come through our site as well, in addition to those that are symptomatic. So that's really the idea. Generally speaking, we're shooting to do about 750 of these a week as we continue to build our testing volume and capability with the supplies that we have. As I always say, it's just like you hear on TV, it's while supplies last. We're going to be able to do this. But we started yesterday. There was a significant response from the community. Today went really well. The hours of operation for that site are Monday through Friday, 9 a.m. to 5 p.m., although depending on how much testing we're doing early in the day, we will close early, depending on the supplies that we have for that day. So come early. That seems to be the trend at the moment, but that's been a positive move for us as well. So very excited. Day 2 seems to be going very well.
And have you been able to test everybody who showed up at that site so far?
So far, so good. Yeah, I think what we try and do is catch people at the entry to the fairgrounds. That's another important detail. It's at the Alameda County Fairgrounds. Through Gate 12, which is the main entrance to the fairgrounds off of Valley Avenue. And so, yeah, we certainly have that conversation before you enter. But if you enter, we likely are going to be able to test you unless we've indicated that we're out of supplies for the day.
Got it. So for the testing sites at your hospital, they need to call their provider first.
Correct.
But to come to the Alameda County Fairgrounds, just if you follow into the criteria you listed, they can show up and find out if they can be tested.
Yep. No doctor's note needed, no appointment needed. And similarly, we will certainly take your insurance and work directly with your insurer, but similar to the other sites that were just discussed, won't bill for any gaps in that coverage. It'll just be a conversation between us and the insurance company, and those that are uninsured and fall into those categories certainly are welcome to be tested at the site as well.
Got it. Now, does someone have to have, you call them drive-through sites. Does someone have to be in a vehicle to come? If you're homeless and you don't have a vehicle, can you come to the fairgrounds and get tested?
Yeah, so we have a walk-up lane that we've established and managed. Admittedly, we think the volume will be fairly low because it's a pretty long walk from the entrance to gate 12 all the way down to where the testing site is. But yes, you can walk up. You'd be directed by the police department that's helping us manage logistics, where to go. And so we certainly have that capability as well.
And Dr. Thiele, do you have to have a car to come to one of your drive-through sites?
Right now, yes, the 5 sites we have open, but for the 3 sites that we're talking with the state about, those will have a walk-up option as well. So more to come, and you can always go to cchealth.org and click on the coronavirus button to see the latest list of locations and instructions.
Great, and I was excited to hear that there's another site coming to San Ramon, hopefully in the next near future. So continuing to expand access, which is critical during these times. So how long does it take to get the results? I know that there's a varying amount of time depending on the test. So can you tell us at these drive-through sites, what should one expect, Dr. Thiele? How about yours?
Yeah, and I just want to say before I get there, we were also talking a lot to all the health systems. So Kaiser, John Muir, Sutter, the Community Consortium, the County Health Network. And so we're encouraging all of them to test also. So don't forget, you can also reach out to your healthcare providers. We're really encouraging all of the systems to test symptomatic people, and we are working on guidelines for asymptomatic people as well. How long? We are sending most of these tests to the commercial labs, mostly Quest, and their turnaround time has been pretty good recently. They told us up to 5 days, but we're seeing that most tests are coming back between 48 and 72 hours. So, and we have a pool of people calling the people who were tested with their result.
Nice. And how about you, Rick?
Yeah. So we actually, as part of the Stanford Health System, we utilize the labs in Palo Alto, and we send our specimens directly there. We say up to 72 hours, but generally the turnaround time is less than 24 hours for the testing that we're able to send to Palo Alto. So it's actually been a very positive development for the community that way, so we can quickly get the test results and then take necessary action at that point.
And that was my next question. So what happens if a test result comes back negative and positive? What kind of follow-up is there? Is there tracing that happens after if it's positive? Tell us about that.
Yeah, so when someone comes back negative, we tell them, hey, lucky for you. And there's no follow-up needed for that, except we do tell people to watch out for how they're feeling and how they're doing. The test is not perfect. It does have some false negative rate, so we tell people to just pay attention to their symptoms and to call for more help if they need it. If you're positive, you'll be given instructions to isolate at home for 7 days from when your symptoms started, or 3 days symptom-free, whichever is longer. And the result will be communicated to the Communicable Disease Program, and they will likely have someone call you and reach out to you and check out, where do you live? Who do you live with? Do you work in a sensitive occupation or a sensitive setting? And there will be a whole disease investigation associated with that. So there's sort of 2 pieces. There's the isolation piece, and then there's the disease investigation piece.
That's great news. And how about you, Rick? What happens at Stanford?
Yeah, very similar. One of the only things that I would add to that is, as you come through the drive-through sites for results communication, somebody will certainly call you. However, we are also set up to sign you up for our electronic medical record. So it's called My Health. And so as you drive through, that would be one of the steps, is we'd sign you up. It's an app that you have on your phone. And the second that those results are posted to the medical record, it comes to you directly. You're able to see it with all the instructions of what you need to do and how you need to respond. And then certainly, as Dr. Thiele had said, we make sure that you're able to connect with a primary care provider if you don't have one, so that you can manage those conversations directly with your your PCP as we go forward, in addition to reporting to the appropriate county authorities, which is an important step so that we can make sure that we're analyzing and managing the spread of the disease in our community. So it's a very similar process with that one extra step.
Yeah, it's really, I mean, I have to say it's incredible as we were talking to you and the county and the cities about setting up this testing site in Pleasanton. One of the critical parts is making sure that as we test people, they're connected into the healthcare system. So that if there is a positive, they're getting the care they need, that it is in the county reports, that we're able to do the follow-up we need. So I really appreciate you being that partner down in the Tri-Valley, because it's a critical piece of this whole, is not just getting the test results, but also the follow-up that comes after.
Yep.
So last question, and Dr. Zvelli, you mentioned this earlier, that you're not at the point where you're talking about the antibody testing, that that's something that may come if we get to a point where we think that's helpful, but there's been a little bit more talk at Stanford about antibody testing. So I wanted to ask you, Rick, is there any antibody testing happening at Stanford Valley Care? Is that something coming in the future? What is the status of that?
Yeah, as you probably know, one of the first antibody tests was actually developed in Palo Alto, and so we've been working on how we deploy that appropriately within our own health system. As Dr. Zvelli said, it's an important thing to distinguish that there's still a lot that we are learning about this disease, and so understanding if you have a positive antibody test, what do you do with that information? That's an ongoing discussion and an ongoing evaluation. So it's not a silver bullet. That's what I tell people when we have the conversation. But what it does do is it gives us a sense for sort of what the prevalence is within a group of people. So what we're doing at Stanford is we are, in fact, testing all of our staff. We're testing all of our physicians with the antibody test to ensure that when you come to the hospital, we have a really good understanding of what are the people that are taking care of you are experiencing. And so we're able to manage it that way. At this point in time, we're not offering that test at the drive-through testing site for public use. However, within the Stanford healthcare system, it is available for all of our physicians to order for their patients. So if your physician believes that that's an important next step for you in an evaluative process, then they have the capability to do that. So we're certainly starting to implement it in a variety of different places, but at this point, I would say it's not a publicly available test without working directly with your physician.
Got it. That's helpful to know. And it's something to pay attention to. I know that I've been hearing from constituents about these antibody testing that's available out on the market now. And I think that I want to point out that not all of those tests are FDA approved, and that you really should be working with a physician and making sure you're getting a reliable and a test and working with your own physician to know what those results mean. And not everything on the market right now is trustworthy. And so that's why we are bringing you these trustworthy sources from both our local healthcare providers and from County Health, because it's important that we're getting the best information. And I see both of them shaking their heads in agreement.
Thumbs up, absolutely.
Mm-hmm.
So thank you both for joining us today and for everything you're doing to keep our community safe. You know, I often talk about, and I'll say it again, the Bay Area really led the way in making sure that we sheltered in place and that we flattened the curve, and we are seeing incredible results as a result of that. And I want to thank you both for your leadership in that. It was absolutely our county health professionals and our healthcare providers who made the hard decisions and followed through on what we needed to do to make sure our communities were well taken care of. And you continue to do that every day. And I know I'm grateful, and my constituents are grateful as well. So thank you. I learned a lot about testing, and I hope many people who listen did. You can always reach out to our office or to your healthcare provider or to the county if you have any questions about this topic. You can reach my office at 925-328-1515. We are there to help you answer any questions you have, whether it be about this or something else. So stay healthy, and thank you for joining us for some good quality information.